Have you ever wondered why people without medical insurance sometimes end up paying less for hospital bills than those who have insurance? It seems counterintuitive, doesn't it? However, it is a hidden truth within the complexities of the American healthcare system. Today, we're diving deep into this perplexing phenomenon to unravel how and why this occurs. Let's start by understanding the basics of medical billing. The process is anything but straightforward. Hospitals and clinics don't just have one price for a service. Instead, they possess an elaborate list known as the Charge Master. This list sets out price points for every imaginable service. Surprisingly, or perhaps not, these prices are often incredibly inflated. They're like the sticker prices on a car window. Almost no one pays them. For insured patients, their insurance companies negotiate rates with hospitals, which are typically lower than the Chargemaster prices, but still considerably marked up. In contrast, uninsured patients don't benefit from this negotiated pricing structure, at least not initially. However, they are often charged the full price indicated on the Chargemaster. But here's where it gets interesting. These cash-paying patients can negotiate directly with the hospital. They can request discounts or financial assistance, sometimes securing deals that end up being cheaper than what insurance companies pay. Moreover, many hospitals have charity care or financial relief policies catering to those who lack insurance, offering services at reduced costs or even for free, depending on their financial situation. Another layer to this puzzle involves the concept of the cost-to-charge ratio. It's a metric that highlights the disparity between what it costs the hospital to provide care and what they bill for it. The reality is stark. The actual cost of services is typically a fraction of the Chargemaster rate. By gaining insight into these financial backdrops, uninsured patients and their advocates can negotiate, often securing lower final bills than the benefits an insured patient receives. Let us also consider the role of Medicare and Medicaid, major players in the healthcare landscape. These government programs negotiate prices that are usually much lower than private insurers' rates. Hospitals adjust their pricing strategies to recoup costs from the high prices set in the Chargemaster when dealing with private insurance entities. This balance means that insured patients inadvertently face inflated billing structures as hospitals aim to counterbalance lower payouts from government programs. Yet, another reason insured patients often pay more stems from network pricing structures. Insured individuals are tied to networks of doctors and hospitals through their insurance companies. The network agreement works to the advantage of providers who then bargain for significant monetary gains. Insurance companies leverage their patient base to secure services at discounted rates. However, hospitals, in turn, accept these discounts knowing that they will make up the profit margin elsewhere, often through insured patients' deductibles and copays. Consequently, insured patients bear the brunt, sometimes facing higher costs than if they had navigated the system alone. In the political sphere, debates continue surrounding the cost of healthcare and the pressure on individuals bearing excessive financial burdens. Legislative efforts often focus on increasing transparency in medical pricing, encouraging fair billing practices, and controlling healthcare costs. While it remains an uphill battle, these debates foreground the necessity for changes that fairly balance costs for all patients, irrespective of their insurance status. So, where does this leave insured patients? They are seemingly in a predicament. While insurance is undoubtedly vital to avoid astronomical charges in medical emergencies, being aware of potential negotiations can be beneficial. Some steps can be taken, such as directly discussing billing with hospitals and seeking financial aid if necessary, even with insurance. In conclusion, the disparity between what uninsured and insured patients pay reveals much about the complexities of healthcare economics. It illustrates the nuanced negotiation landscape and balance of hospitals' financial strategies to maintain sustainability. While the system isn't uniformly designed with inherent fairness across every patient type, understanding these elements can empower individuals in medical billing. As we peel back the layers of healthcare's financial framework, Remember that this knowledge won't just fill the gaps, but might aid you or others in navigating one of life's most essential needs without unnecessary financial strain. Until next time, let us continue seeking clarity and advocacy in the complex web of healthcare services.